What does clinical medicine mean? Clinical medicine refers to the branch of medical practice that involves the direct observation, diagnosis, and treatment of patients. It focuses on the practical application of medical knowledge and skills to patient care, as opposed to theoretical or laboratory-based research. Clinical medicine encompasses various aspects, including 1. Patient examination, conducting physical examinations and taking medical histories. 2. Diagnosis, identifying diseases and conditions through clinical evaluation, diagnostic tests, and medical imaging. 3. Treatment, providing medical, surgical, or therapeutic interventions to treat diseases and conditions. 4. Patient management, monitoring and managing patient progress, including follow-up care and rehabilitation. 5. Preventive care, implementing strategies to prevent diseases and promote health. Practitioners of clinical medicine include physicians, nurses, physician assistants, and other healthcare professionals who work directly with patients in settings such as hospitals, clinics, and private practices. This content is only an example of learning English. This is a VTP channel. You can find us at youtube.com/VTP. Examples of clinical medicine in the sentences. 1. Again, this is observed across clinical medicine and is not unique to this situation. 2. Application of the enlightened vision resulted in an expansion of clinical medicine and the belief that sickness could be controlled. 3. Clinical medicine has been called the youngest science and is claimed to have appeared as late as 1950-30. 4. Clinical medicine, as it is now practiced, would be impossible without their help. 5. Contributors include anthropologists and social psychologists, as well as those in several fields of clinical medicine and medical research. 6. However, things have moved on in clinical medicine. 7. I have not considered the importance of therapeutics, the true spearhead of clinical medicine, and its true spirit. 8. I think reflective practitioners of clinical medicine or clinical ethics should read this book. 9. In other contexts, such as clinical medicine, inaction could be as morally laden as active action. 10. In science in general and in clinical medicine in particular, the tentative empirical approach was crucial. 11. In the case of clinical medicine, those who hope for promotion must also demonstrate clinical competence. 12. Indeed, in the end, clinical medicine is insufficient to explain the captain's interesting case. 13. It was therefore clear that clinical medicine was in jeopardy. 14. Its members include experts on research methodology, administration, and clinical medicine. 15. Nevertheless, it is the ultimate locus of authority in clinical medicine. 16. Nor did clinical medicine have much impact on the health or longevity of the population. 17. The analogies and examples here drawn from clinical medicine are informative. 18. The best evidence is thus contradictory, as so often happens in clinical medicine. 19. The board of referees will contain members from the fields of clinical medicine, bioengineering, and biochemistry. 20. The current approach to clinical medicine is strongly provider-oriented, but disease management emphasizes the client side. 21. The new medical sciences were not fully compatible with clinical medicine. 22. The term refers to the observer's subjective, affective relation to the observed, exactly the construct that clinical medicine wished to avoid. 23. They are central realities in clinical medicine. 24. This phenomenon is apparent in both research and clinical medicine. 25. Will the flood of new data, concepts, and theories revolutionize psychology or clinical medicine? This content is only an example of learning English. What do you think of this video? Please provide your feedback below. Thank you for watching. This is a VTP channel. You can find us at youtube.com/VTP.